Hey guys, welcome back to the channel. I just got my eyebrows done, that's why they're very dark. But welcome back. This is a video I've been really wanting to make. May is actually Brain Cancer Awareness Month, and so I didn't have brain cancer, but I almost did. So I just went shopping for Cam if you see the bags. But let's just jump into it because there's a lot of information. Pretty much going to be talking about my experience, my brain tumor, everything like that. So here's a book my mom made me. This was me when I was 8. This was 22 days after I turned 8. I went to the hospital. So this is me. Let's just go through it, okay? So this is sort of an album my mom made because she knew I wouldn't remember anything. I don't remember anything from before my brain tumor and anything in the first hospital. My first memory ever is from when we went to the second hospital, and I'll tell you about that. So I went into the hospital to chalk. I was referred to the chalk ER on October 30th after going to the eye doctor because I was having a bunch of headaches at school and with focusing, and even in other ways. And so my mom brought me to the eye doctor thinking I needed glasses. The eye doctor said, whoa, she has a lot of fluid and pressure behind her eyes. She needs to go to the chalk ER right away. So I think I even went on ambulance, or I don't know, really, like, no, don't pass go, collect $200 straight to the ER. And they gave me an MRI and decided that they needed to do a surgery right away to get rid of the pressure behind my eyes, or they were afraid I was gonna have a stroke. So that's pretty crazy, little 8-year-old me. But actually, so this page from our room, you could see the Angels Stadium, and I love baseball. We went to Angels games all the time when I was younger, so that was really cool. Also, I didn't know most of this information until 2 days ago. I talked to my mom about it. I didn't really know anything because we didn't ever really talk about it, but so most of this I just learned, so I really want to share it. This is before my first surgery, which was right here, to go behind my eyes and release the pressure. They had to shave these little things in my head. And this was the first surgery. So it's crazy. And then this was, I had like more fevers, so they had to get rid of them, and headaches and all that stuff. Then after that, they determined that they thought it was cancer. So the tumor that they thought it was, I don't remember, the hemoblastoma maybe, some cancerous bad tumor, they thought it was. At this point, we were waiting for surgery. Shelter dogs came in. I went in the day before Halloween, and it was very upsetting that I didn't get to be a witch. But this is 2 days after Halloween, November 2nd. November 6th is when I had my main surgery. It was a Tuesday. I had this surgery. It was right here. I still have a scar right here, to get rid of the tumor. And so at this point, I still thought it was cancerous. So that's that. And then after my brain tumor, I didn't open my eyes, but I did reach out for the shelter dog, or like the therapy dog. And you know how after surgery, you're supposed to wake up within a few hours? Well, I didn't. So I wasn't awake. I didn't wake up on that Tuesday, that Wednesday, Thursday. Friday came along, and they were scared. They're like, this page, Sea of Wires. So by Thursday and Friday, the doctors were concerned that part of my lethargic state and not talking after my brain tumor was because of cerebellar mutism and posterior fossa syndrome. So that's another thing I just found out about. I've had this book for years, like since I was 8, and I never comprehension. So we'll talk more about that. And so also I couldn't, and once they realized I had posterior fossa syndrome, which is also known as cerebellar mutism, They gave me an NG tumor right away because they knew I wouldn't know how to swallow coming out of surgery, which is intense. So I have 3 scars, one right here, and one on my stomach from my NG tube. It looks like a second belly button. Anyway, so I'm a wild sleeper, but this is on that Friday. They were able to get me up, and they had to get me up and moving a little bit, or else they were afraid I would get pneumonia in my lungs. So this was me right here, cute little me. And if you can tell, you look at my face, obviously I just got out of surgery. So for cerebellar mutism, there's a whole bunch that goes along with that. So that's why I have really bad balance still to this day, almost 14 years later. I am not great at comprehension, which is why I never really put things together. I struggle to find words very often. I have some coordination issues. There's a bunch of things here and there that I still struggle with, but majority of it was fixed in therapy. Cerebellar mutism is also part of it. It affects psychological, neuropsychological, language and speech, and a bunch of stuff. It affects everything. Well, I didn't know how to walk, talk, swallow, and like everything. I had to relearn all of it. Imagine that. I was pretty much an 8-year-old newborn. But I knew how to do it. I just couldn't. So once I learned how to do it, it all came back pretty quickly. I mean, it still took months, but it was coming back to me. And so it was an interesting time, and so that loss of personality is a very serious phase. I didn't smile for a while. I wouldn't say a while, but like a bit. I didn't smile. I actually didn't stick out my tongue until a while after surgery, which is the first sign that I had cerebellar mutism, because I couldn't do that. I physically could not stick out my tongue, which is crazy to think about. So I'm still very serious. If I'm just not doing anything, I just look serious. I look angry, and people think I'm mad a lot of the time when that's how I am. I'm a complete, after my brain tumor, is a complete different person from beforehand, which is wild because I have no recollection of her. And so I don't have any memory of this, but like, look at that little face. I was just everything. So this was more sleeping, getting up, trying to walk, recovery, therapy. This is the first memory I have. This is my the Theratog suit, which was like compression, which is why I like compression today, I think. It is to help teach you to walk and all this stuff. I had a lot of therapies. To be able to transfer to the other therapy, St. Jude, for the other hospital for therapy, which is St. Jude, I had to be able to handle 3 hours of therapies at chalk. So once I did that, I could transfer over. Also, this, right here, now they knew it was not cancer. So it was 9 days after my surgery that Dr. Lin from Mayo Clinic confirmed that my brain tumor was benign. And I still to this day have periodic MRIs to check on that spot to make sure it's gone. But knowing that was really good because I wouldn't have to deal with it technically forever, even though I still am dealing with it forever. So it says you'll need periodic MRIs to monitor your spot. Our goal was to continue with your therapies, and there was talk about you possibly needing a feeding tube to supplement for oral skills improvement. Before I left, I had vomiting and a fever. They thought it was the flu. But I also had very sensitive skin because of the cerebellar mutism. I was very irritable, and so my mom said, imagine your worst night's sleep times 1,000,000. I think that's why I'm a violent, really bad sleeper today. I'm a good sleeper, but I'm insane. Like, I move so much. I would move constantly in the bed, like my arms and my legs. I would have sores on my wrists and my ankles because I couldn't stop moving because of the cerebellar mutism. So then going to, so eventually, I mean, that honestly never really ended, but it's okay. I'm more restful now, but it's a process, you know. My mom said she would like lay next to me with half her body weight on me to try and get me to just rest and stop moving. Now, whenever I went to Chalk or St. Jude, I was in this netted bed because I would try and get out, but I couldn't walk because I wanted to get out. I hated just sitting still, but because I'm very independent, I don't want any help ever. So, but yeah, so the nurses made me that bed. It gave me that. My left eye, so because of the cerebellar mutism, posterior fossa syndrome, the left side of my face had a lot of facial paralysis. And so you can really tell here, this was like for smiling. So the left side of my face was just, and it still is, my left eye is like, a lot of the time it's not like as open, it's more of a droopy eye. Not all the time though. So they had to try to get my left eye stronger. It's still weaker than my right eye, but so this was more of all that, me with two of my siblings. All that stuff. This was Thanksgiving. I was at the hospital, but I was able to go outside with my family. This was whenever I got all the tubes out of my face. This was me relearning how to swallow, which is a wild thought. Pretty crazy. They had to put thing on my vocal cords and this stuff, and it would like vibrate and help me learn how to swallow. I don't know. It's pretty crazy. You can see more of the facial paralysis a little bit here. I don't have that as much with smiling anymore, but my eye is still like affected. And then this was me being able to go home. I went home on December 11th. So I went into the hospital day before Halloween and left December. So I was in there for 6 weeks, and I still had therapies for a while after. Also, after my brain tumor, here's me going home. My amazing doctor, you see my facial paralysis here. Dr. Loudon, he's incredible. He saved my life. And then on February 23rd of 2009, so this is a few months after, I'd have a gamma knife radiation treatment, which, this is me. I was asleep for it, but I hated that haircut. Worst haircut ever. But I had to have this, and what it would do is I still had a few brain tumor cells, so they had to zap it and let it shrivel up and die because they were afraid it was going to grow more if they didn't get rid of it. So that was pretty crazy. And then this is the absolute worst picture ever. That's all you need to see. I don't know why. It was the worst haircut ever. They had to cut it that short though because how they had to shave spots in my head for my first surgery of right here. So now I'm here. That was my whole brain tumor story. Not all of it. Actually, there's still a lot that I don't know. And there's so much I don't know about the brain. I also, from that, I can't cry still. So I haven't cried, technically. I haven't cried in almost 14 years. I can cry, like I can make my eyes water. My tear ducts still work, but I don't know, I just can't cry, which is quite interesting. The doctor doesn't know why that happened. Also, beforehand, I was very ticklish. Now, not ticklish at all. Like, even like right after my brain tumor, never, not ticklish. And so it's wild how my personality changed dramatically. My serious face. I used to be super happy-go-lucky. I'm not really happy-go-lucky now. I'm not mean, but I can be. So it's the seriousness, you know. I'm a lot more loss of personality at certain times. Like certain times I just don't have much personality, but I also make up for it in other times because I feel like I need to, and I have a lot of personality then, and it's because of my brain, because I know that I don't always have that, so I need to make up for it, and then when I don't have it, I try to make it there, and then it doesn't really work out well. Anyway, that is my brain tumor story. Thanks for listening, watching, all that stuff. I've come a long way. It's been 14 years, and so happy Brain Cancer Awareness Month. I'm so glad my brain was benign, because if not, it would be a lot more difficult. But yeah, so have a good day.